This is the Patient Safety Awareness Week webinar. We celebrate this every year. Usually we do live events in the staff dining area. Unfortunately, we're not able to do that this year. Hopefully next year we'll be back to having live events. Hopefully all of you have taken advantage of the Matheny vaccination program. We have vaccinated over 1,000. We have done over 1,000 doses as of today. And we've been able to successfully vaccinate all of our group home clients and many of our hospital inpatients and our outpatients. And so I think it's been a very successful program. We don't have any new first doses to offer right now. Hopefully we'll get them in the future again. But if you have not been vaccinated and wish to be vaccinated, you ought to go on the state's website, covid19nj.gov, and you can look on there on how to get vaccinated, or go to CVS's website or Rite Aid's website or any of the major hospital systems websites and your county that you live in. So all of those have scheduling programs within them so that you could get your vaccination. The only way to get out of the COVID-19 pandemic is for us to all be vaccinated against this disease. So Patient Safety Awareness Week, we are celebrating this week, and one of the main themes is that together we are stronger, and one of the ways that we kind of work together is by making sure that we are talking about things that don't go right for us. So we want to make sure that you are reporting incidents, whether they're close calls or unsafe conditions, or we say whenever something didn't go exactly as you had planned it to go, that's an incident report. And remember, we're not reporting people. We're not reporting on each other. We're not tattletaling. What we're doing is we're saying to the quality managers and the nurse managers and the other leaders of the organization or clinical directors, what you're saying is, look, this is not going well. This didn't go well for me today. Let's investigate it. Let's figure out why it didn't go well. And you know what? Something may not go well for you once, and you don't know that it happens hundreds of other times to other people in the organization. So that's the reason for incident reporting. And really only through robust reporting can we get ourselves to a situation where we are truly delivering exceptionally safe, high quality care to every patient every day. Hopefully everyone can see the slides. Okay. Patient safety throughout the country is still a huge problem. We've been working diligently on this as a main theme of quality improvement across the nation and the world for over 20 years now. I could tell you the numbers are really not changing that much, unfortunately. And there are probably over 250,000 people a year in the United States that die because of a patient safety incident, because something didn't go right during their hospitalization. And, you know, we know that healthcare is delivered with a 2 to 4% error rate. And, you know, these things add up, and we're talking about 18 million adverse events a year in America's hospitals. By the way, happy St. Patrick's Day. I did find some shamrocks to wear. Thank you, Kim Foreman, because I didn't wear anything else that was green today, unfortunately. Florence Nightingale said over 100 years ago, the very first requirement in a hospital is that it should do the sick no harm. And that seems like such a basic statement to make, but you know, what happens is people go to a hospital for one reason and then get a complication because of a patient safety problem. Maybe they acquire an infection while they're in the hospital. Maybe they acquire a pressure ulcer while they're in the hospital. Maybe they fall out of bed while they're in the hospital, and they end up with other harm events that had nothing to do with why they were in the hospital to begin with. And we see all these things at Matheny, and that's what we're struggling with to prevent. Obviously, in the last year, we've been really working hard to prevent COVID-19 infections, and we have all kinds of restrictions in place. We've been, I think, very successful at Matheny in fighting COVID-19, although we have paid a price and we've had patients pass away and we've had the staff members been sick and a staff member pass away. But all in all, a lot better than it could have been. But one thing that's come out of this season, with all of us being in such a state of readiness for infection prevention, is that we've seen, knock on wood, almost no flu. So flu has been low in all of our communities, and it's been low here at Matheny. So that's, I think, probably, with all the respiratory and infection control protections, a good thing that's come out of all this. So just to reiterate our patient care mission at Matheny, whether you work in the hospital, in a group home, in the day program, for the school, in any of the other support divisions, providing exceptionally safe, high quality care to every patient every day is our patient care mission here. That is what gets us up in the morning. And we've gone through in other presentations what these things mean. This is the definition of high reliability healthcare, meaning that you get it right 99.9996% of the time. So that's a 6 Sigma level of adverse events, and that's what we all strive for. And many of you have committed your time to becoming Lean Six Sigma green belts. Some of you have committed your time to becoming Lean Six Sigma black belts, and I commend you for that. That's a tremendous investment that you've made in improving the quality of care here at Matheny, and I thank you for that. A tremendous job, because our black belts and our green belts are working on all of our interdisciplinary teams to improve the quality of care here for our patients, clients, and students. So 4 basic principles I'm going to present. I published these a couple of months ago in the International Journal of Healthcare Management, and I think there are 6 in that publication, and we'll make that available to everybody. But I want to concentrate on these 4 because I think these are basic principles that ought to help us get to exceptionally safe, high quality care. Remembering that we're only human, quality improvement is a part of everyone's workday. Planning is everything, and it's what you know that matters, not necessarily who you are, but what you know that matters. So we'll go through them one at a time and talk a little bit about what these things might mean for us. Humans make mistakes. You know, there's no one that's going to perform perfectly. That myth of perfect performance is just that. It's a myth. It's not reality. So we need to think about, when we're delivering healthcare or when we're doing anything, if you're designing software, if you're making an automobile, if you're building a bookcase at home, think about when and how the process is going to fail. You hope it doesn't fail, but hope is just that. You have to be building into any process of care that you may be doing for any patient the idea that this is going to go wrong, when is it going to go wrong, and how is it going to go wrong, and then plan for that and figure out how you're going to, number 1, prevent it from going wrong, number 2, recover from when it goes wrong. That's resiliency, be able to bounce back from it, and then learn from when it goes wrong so that it doesn't go wrong again. So some processes in hospitals only work at 50 or 60%. You know, hand hygiene, something simple that we learned in preschool. But Matheny does very well. Matheny has consistently been over 80, 90% in getting folks to clean when they go in a room and clean their hands when they come out of a room, and doing the gloving and the degloving appropriately. But most hospitals don't do that well. to our credit, I think we do pretty well. We need to drive our reliability to the level of 99.99%. That's really where we need to be. And the only way you're going to get there is by reporting close calls and unsafe conditions. You know, we want you to report adverse events when they happen in RL6, but, you know, we need to hear about when things don't go exactly as you planned. Tell us about that. Put that in RL6. And you know what? If somebody says to you, you shouldn't have put that in RL6, that's not an RL6, that's not an incident report, we need to hear about that as well, because we want to encourage you to report. If anything, I want to encourage you to over-report. Let us, on the back end, let the administration figure out, well, this one maybe, we've only seen this once in the last year, so we're not going to worry about that particular incident. It was a one-time thing, and we think that we can fix what happened there. Let the administration decide. Let, you know, Kim Foreman and Ken Roby and all the quality improvement teams, the patient safety committee, the QI committee, the infection control committee, let them see what's going on out there. And if somebody says to you, oh, you shouldn't report that, that ought to set off a bell in your head, because you should report everything that doesn't go exactly as you planned it to go, or exactly what you expected to have happen. If that didn't happen, that's an RL6, and we need to hear about that. So high reliability is really the goal, right? That means that every team member, whether you're talking about the vice presidents, the incoming CEO who's going to join us at the end of the month, Mr. Kent, or you're talking about everyone on the front line, our nurses, our PCAs, our therapists, the whole team is sensitive to operations, meaning that we have an understanding of how hard it is to be a frontline member. We understand how difficult it may be to be a nurse manager, or to be a therapy director, or to be a pharmacy leader. We understand that. We're sensitive to operations. We understand that there's a way to do things, and we want to support how we do them correctly. Everyone on the team is obsessed with failure. That's the idea that our processes will break down. We have to figure out when they're going to break down and how they're going to break down, prevent them from breaking down, and figure out how we're going to recover and prevent harm from reaching the patient. We're going to show resiliency when things do go wrong, meaning that, you know, we can bounce back and recover, and ensure that we do the proper reporting and do the proper fixes. We follow through when we investigate a problem, that we follow through and fix it. We also show reluctance to simplify complex problems because some things just need to be learned. They can't be simplified anymore. We just need to figure out a better way to teach them. And then we have deference to expertise over hierarchy. And that's the idea in one of these principles, that it's not who you are, it's what you know. And we need to take advantage of the skills that people have and things that they bring to Matheny from, you know, other parts of their life, or special skills that they may have developed in their professional development. Quality improvement is a part of everyone's workday. So, you know, this means that we're encouraging you to make improvement suggestions. And that's part of the incident reporting. If you see something doesn't go right for your patient or your client or your student, you put in the RL6 report. And as part of that, you're telling us, hey, look, here's a suggestion. Here, you know, here's how we do it. And here's how I think we ought to do it. And then we work on that. The other thing is getting involved. So everything I send out to you, just about everything about patient safety, whether it's the QI tip or other notices about Patient Safety Awareness Week, have invited you to join the Patient Safety Committee here at Matheny. And I would encourage you to do that. And you just call my office or Kim Foreman, she's the chair of Patient Safety Committee, and feel free to volunteer and join us at the committee meetings and begin to learn about, you know, how things are going here and what you can add to the solution set, because we're always looking for people that will look at our problems with a different light. You know, sometimes that that new flashlight is the one that's magic and helps us figure things out. So we want to make sure that you're speaking up, and that not only you're speaking up, but we're hearing you. That's important. That's the most important part of incident reporting, is that somebody's on the other end of it. So I could tell you the leaders of this organization, quality improvement leaders, the clinical leaders, the clinical directors, are on a huddle every morning. And one of the key pieces of that huddle is Ken Roby going through the incident reports that were entered on the previous day and making sure that we have an understanding of what went on there, and that we begin to do our investigations, and that someone is going to be responsible for following up on that. Do we have to do a root cause analysis for the problem? Do we have to report things to different regulatory agencies, et cetera? So that's kind of the first way that the leadership begins to get involved, leadership and management, with your incident report. Planning is everything. So, you know, I think General Eisenhower said this a long time ago, and it's true. It's as true today as it was back then. Being obsessed with failure means that steps have been taken to plan for such failure when it occurs. So that's that kind of understanding that things are going to go wrong and we ought to be planning for it. And you know, we have two tools that we use to try to unwind complex processes and avoid error-prone processes. We will call one of them a root cause analysis and action. That means, you know, that's kind of the 5 whys, where you look at a process and you look at each step in the process of what happened to someone. It's something that we use to investigate an actual adverse event or close call that might have happened. And we try and we ask ourselves, why did this happen? And then once we get that answer, we say, well, why did that happen? And then once we get that, we try to go deeper into that, to the 5 whys, and try to uncover the root causes. I could tell you the investigation of most unsafe conditions, close calls, and adverse events happen because of communication failure. That's usually a root cause, but then there are other root causes that feed into that. So communication failure usually isn't enough to cause a harm event. There's usually other things that have gone wrong as well. And that's why doing that exercise, the root cause analysis, and then action, meaning that you develop an action plan to fix it, is crucially important. The FMEA is a failure mode and effects analysis, and that is a prospective tool. So that's a tool that when you're bringing on a new product or you're bringing on a new process, that's a tabletop exercise that you do before you start exposing patients to the new process of care. And you try to figure out all the steps that are going to happen in the process, and you try to figure out where it's going to fail. And then you go forward in your planning so that when you do go live and start taking care of patients, you've already figured out some of the failure points and hopefully fix them so that they're not failure points anymore, or figured out a way to recover when things go wrong in those pieces of the puzzle. So again, no one can fix what they cannot see. And that's why hearing from the front line and from our supervision management team is very important. Reporting is the key so that we can get to the point where we use the tools at our disposal to improve the quality of what we're doing. So it's what you know that matters. And, you know, rather than the position that you hold and, you know, this is called a deference to expertise over rank. You know, I often tell the story, at the institution I worked with before, the person who was responsible for our command center was not a vice president or a president of the organization, was not even really a manager or a supervisor. He was a person who was an EMT who had great expertise in running emergency command center type operations. And he did a great job. And he had, you know, wide ranging powers when we opened the command center. And indeed, you know, the president of the organization would show up for their briefings from this person and kind of get their marching orders, and all the administration would find out different problems that we needed to solve and bring them back to the command center so that they could be put into place. And this person was the coordinator, and he had almost no rank in the organization. And we all believe that because of our deference to expertise over rank, he was the right person to run this organization during an emergency like that, a command center type emergency. You know, those were things like Hurricane Sandy or other such problems we would have at, you know, Newark Airport, or the Ebola scare, things like that. But also could be things like power outages and the water stops working and we don't have hot water, all those kinds of things. Also, as managers and leaders, we need to dedicate enough time to designing and preparing training and education for our clinical caregivers. That's the only way to make sure that we deliver safe care and facilitate a safe environment for both our patients and our staff. And really, the best outcomes are realized when teams of people work together and are not distracted by a hierarchy. You know, I'm the boss, therefore you have to listen to me. Well, you know, we've been working on this problem for 12 hours and we have a lot of different solution sets that we're working through right now. We think we understand it, and then this boss decides they're going to walk into the middle of it and take over. That's really going to be disruptive to all the things we know actually help improve and solve problems, especially around clinical issues, and especially around patient safety. So let me try to land this plane that we've been flying at 30,000 feet here. We owe it to our patients. We owe it to each other to ensure that we're delivering safe, patient-centered, evidence-based, timely care to every patient all the time. That's the expectation. When people come to us for care, when families admit their family members here under our care, when people move into our group homes, we're going to be opening 2 new group homes, hopefully by the end of 2021. When people move into those group homes and become our clients in the community residences, when people show up at our Hillsborough Day program, we're going to be opening that soon. Hopefully the beginning of April, we'll be opening that. When people come to our clinic for care, when they come to see our dentists, they're expecting to have safe care. They're expecting to have an experience that they're going to be satisfied with. They're expecting to have an outcome that also satisfies them. Stapling best practices onto failed processes will not result in high reliability healthcare. You won't get exceptionally safe care. You won't get high quality care by stapling old practices onto failed things that you're already doing. It needs to be what they call a paradigm shift, meaning that the model for care changes, meaning that you begin to endorse, embrace this idea that you can get to a state of mindfulness in healthcare delivery by following those principles of high reliability, by following these basic principles for patient safety, and eliminate preventable harm. Once you eliminate preventable harm, then you can begin working on the other pieces of the puzzle. And the only way you eliminate preventable harm is by developing this blameless, just reporting culture. Reporting incidents, reporting close calls, reporting unsafe practices is really the way that we arrive at the promised land. The promised land being healthcare that is 99.99% effective and safe and efficient. That's the only way to really get there. So this is the article. We'll make sure that this is available to everyone from the International Journal of Healthcare Management. And hopefully everyone enjoyed this. There's a lot more events this week for Patient Safety Awareness Week. We want to make sure everyone is able to follow through on things that we talked about here. I want to make sure that everyone is quite clear. If you look on your screen, you might have a Q&A or a chat box. If you have any questions, you can put the Q&A, your question into the Q&A queue there and type them in. I don't know if you have that available to everyone that's there, but hopefully I worked through all your questions. And if not, and if we can't get to them here, just send me an email or something if there was something you were thinking of. Or if you want to join the patient safety committee, or you want to be part of the QI committee, or any of the other committees that we have that are working on these problems that affect our patients. We are expecting the Joint Commission to visit us any day now. We're working on accreditation for our wheelchair manufacturing operation for seating clinic, et cetera, rehab engineering. So we're expecting them. And we're also entering the window of Joint Commission accreditation. So obviously, that's one of the main ways that we prove to the outside world that that's one of the ways that we prove to the outside world that we are actually delivering safe, high quality care. So I thank you all for your time. I appreciate it. I don't see anything in the Q&A or the chat. If you have any questions, you want to call me 1290, or if you want to send me an email or something, that's fine too. And I hope you all have a safe day. Enjoy. The weather's not so great today, but at least it's getting a little bit warmer. And like I said, if you haven't gotten your vaccine yet, reach out to all those avenues of places that are still vaccinating. We're completing our second doses now. We'll be done with that by the end of March. We hope to have vaccinated 66% of our staff members. Probably about the same, 66% of our inpatients. All of our group home clients have completed their vaccination so far, and then looking at other people that may be available. And we're working to get other vaccines here. We've used the Moderna for these last month or two, but there are other products coming out on the market. So thank you very much for your time. I appreciate it. If you have any questions, drop me a line, and I thank you for your time and your commitment to patient safety. Thank you all. Bye-bye. Have a good day.